Hola, estamos aquí en el IMSS con un familiar de un paciente aquí del IMSS y vamos a hacer una entrevista muy corta. Hola, ¿qué puede hacer el gobierno para mejorar la experiencia de un mexicano en el tema de la salud pública?
Hola, pues hacer más hospitales para que atiendan bien.
¿Y crees que debería de recibir mejor educación los doctores y las enfermeras en México?
Así es, para que atiendan mejor y que estén bien preparados.
¿Crees que los hospitales públicos y privados deberían de tener doctores con la misma experiencia en el público y en el privado?
Así es, deben de recibir la misma atención, ya sean pobres y ricos.
¿Y por qué los tiempos de espera en los hospitales públicos son tan grande problema hoy en día?
Pues no sé. Eh, Pues falta de atención médica, pues no hay suficiente aparatos, todo tipo de medicina, por eso se alargan los tiempos.
¿La medicina crees que debería de ser más barata?
Sí, debería de ser más barato para que sean atendidos a todos y que tengan medicamentos a todos.
Y por último, ¿crees que los pacientes en los hospitales son tratados diferente en los hospitales públicos que en los hospitales privados?
Así es, porque creen que uno no tiene con qué pagar, pues sí, lo hacen menos. Y pues no debe de ser así, debe de ser atendidos por igual.
Ok, perfecto. Muchísimas gracias.
De nada.
Hola, estoy aquí a punto de hacerle una entrevista a un paciente aquí en el IMSS y le voy a hacer una pregunta. ¿Está bien?
Sí,
Y bueno, la primera pregunta es, ¿qué puede hacer el gobierno para mejorar la experiencia de un mexicano en el tema de la salud pública?
pues tener más hospitales y tener más capacitación.
¿Crees que deberían de recibir mejor educación médica los doctores y las enfermeras en México?
Yo creo que sí, y que haya más centros de capacitación para las enfermeras y doctores.
Ok, perfecto. ¿Crees que los hospitales públicos y privados deberían de tener doctores con la misma experiencia en ambos sectores?
Yo creo que sí, debería ser la misma experiencia tanto como uno para el otro.
Ok, perfecto. Y luego, ¿por qué los tiempos de espera en hospitales públicos son tan grande problema hoy en día en nuestro país?
Pues será por falta de hospitales y por falta de doctores.
Sí, yo creo que sí. ¿La medicina debería de ser más barata para todos?
Yo creo que sí, debería ser más barata para todos en general.
Y por último, ¿crees que los pacientes en hospitales públicos son tratados diferentes que en los hospitales privados?
Yo creo que sí son tratados diferentes.
Ok, perfecto. Bueno, esto ha sido nuestra entrevista y muchísimas gracias. Hi, I'm here with a former IMSS doctor and I'm going to ask him some questions. What can the government do in order to improve the overall experience in the health sector in Mexico?
What can the government of Mexico do to improve the overall experience in healthcare? I think basically two things. They have to achieve a decentralization of the medicine and then increase the investment, the annual investment of its GDP, which I think Mexico nowadays is spending probably 3%, around 3% of its total GDP. And if you compare it with United States a couple of years ago was spending like 8%. So definitely there needs to be a much more investment, and this money should be administered correctly. And all the consequences of this investment will be translated in better centers, hospitals, machinery, and obviously the staff. The second thing I said was decentralization, which means that the tertiary hospitals and centers shouldn't be located only in the big cities, where the other small cities have only primary or secondary centers that in an event of a not an emergency but a difficult diagnosis or treatment, they will have to make a referral to the tertiary center, and this makes it difficult for the transport. This increases the number of patients that need to be treated in the same center and makes the waiting lines and time longer. So basically, yeah, it needs a better, a much more investment and a better administration of the money. So every every city has a tertiary center uh, and a referral center to be able to treat every type of diseases.
Should doctors and nurses receive better training in medical education in Mexico?
Doctors and nurses receive better training and medical education in Mexico? I doubt it. I think education is the educational system in health is well. There's good universities and schools. What I think it could improve is the salary or retribution these professionals receive during its latest training. I'm not speaking about career wise, but for example, in doctors, when they have to specialize, they go into residency and their salary is really low. And we're speaking of professionals that already did 7 years of medicine. They're around 20, 27, 28, and 31 years old and still are receiving a very low salary, which makes it difficult for them to continue with their personal and professional dreams or goals. This will make uh, an anxiety or make the medical a little bit more hurry to graduate, to be able to start working when, if the salary was better, uh, then the professionals could focus on more training and more subspecializing, so they can be better prepared at the end.
Should public and private hospitals have medical staff with the same amount of experience?
Public and private hospitals have medical staff with the same amount of experience? Definitely. There shouldn't be any difference. Uh, Even the staff could be the same, and sometimes is the same, because there's no reason why it should be different. Public or private hospitals should have the same staff, should have the same equipment, uh, in an ideal situation, right? But there shouldn't be any difference between both.
Why are waiting times in hospitals such a big problem for people with public health care?
Why are waiting times in hospitals such a big problem for people with public health care? Same thing we were talking earlier. Problem is that there are very few hospitals with enough technology, equipment, and infrastructure to be able to treat every type of disease, or to be able to offer all treatments. So what happens is that people in small centers are referred to the tertiary hospitals, and this is where the line and the waiting becomes very, very long. So the solution is what we said earlier, the decentralization of medicine. And not only hospitals should not only hospitals, also the staff, the medical staff. So you shouldn't only have subspecialized physicians in big cities, in big centers. So every city should have its own tertiary hospital, uh, so patients are not referred to other cities, and even the small cities should have qualified doctors with subspecialization to be able to treat the patients. So when you spread the qualified staff, when you spread the technology centers with equipments and enough infrastructure to every city in the country, that will make the universal healthcare that every country wants to achieve, and this will make the lines very much shorter.
Should medicine in general be more affordable to the public?
Should medicine in general be more affordable to the public? Well, this is a very general question. I don't know, we could divide it into, when speaking about medicine, we could divide it into like medicine, the pills, medicine, the service, or the consults, or the treatment in hospitals. But trying to answer the question, it should be more affordable for the patient, yes, because health should be one of the uh, uh, not priorities, but human rights in independently depending on which country you are born, you should have the right to have a decent healthcare. In the other hand, it's a really expensive world if you want to see it that way, because the hospitals with the machine, the instruments, the technology needed, all the material used for even the smallest procedure, uh, all that is really expensive. All the investigation and laboratory experiments that have to be done, or the years of testing for to be able to have one uh, medicine for the headache working, it's really very expensive. Not to mention all the years of preparation and study doctors and other health staff have to pass by. But in the end, all this should be covered by the government again, and that's a problem when the government doesn't give a a good healthcare system for the people. Then that's why the private sectors is so uh, unaffordable for most of the people in the country. That's why the private health system, and it's really expensive. And in the end, you have two worlds. You have the public system, which has a very low level and sometimes low quality, and sometimes like big lines, as the question before. And you have the private world where everything works, but it's really really expensive, only for less than 10% of the population. So in the end, yes, it should be more affordable for the patient, but to be able to cover all those expenses, then the government should invest more in the healthcare system. Speaking of hospitals and staff.
Are patients at public hospitals treated differently than in private hospitals?
Patients at public hospitals treated differently than in private hospitals? Well, they should. You shouldn't be. Unfortunately and sadly, anyone that has worked in both public and private hospitals has seen that there is sometimes, yes, a different treatment, unfortunately, and it's a very sad situation, but you have to be honest. You cannot generalize. It's not every hospital, it's not every staff, but definitely there's staff that would treat patients differently, and there's many factors involved. And once again, we come to the economy factor, which is really important here, because when you have a working environment, speaking of public hospitals, right? When you have a working environment that is not the ideal, when you have the equipment which you're working which is not the ideal, and you notice and you live without having all the necessary material, equipment, or medicine, and when you sum to all that your income is not which the one you would like or you think you deserve, then obviously the mood from the health staff won't be the same if they would be working with the salary they want, in the environment they want, and having all the instrument to be able to help the patient. Hospitals are already a very stressful place to work. The environment is really stressful, so the working conditions should be ideal, but once again, that's not the reality. So it's a multifactorial uh, problem, but I guess those points that we talked about before would really make a difference. There's a long way, not only in Mexico, in every country, but you gotta start somewhere.
Well, this concludes our interview. Thank you, doctor, for your time, and thank you for listening.